Hi Ingrid.
Hi.
My name's Delaney and I'm going to be your occupational therapist. So I read that you had a pretty bad mountain bike accident and we're just going to start getting you back to some of your normal daily activities. And I read in your case, your profile, that you really want to get back to some of those self-care activities like brushing your teeth, brushing your hair, some of those things.
Yeah, that's really important to me.
Okay. And then I also read that you have some pain, like in your neck and shoulders and your head. Is that bothering you today?
Yeah, it kind of always bothers me a little bit.
Okay. On a scale of 1 to 10, 1 being like no pain at all to 10 being the worst pain you can imagine, where would you rate that pain today?
Probably like a 6. It's usually always at a 6.
Okay. Well, if you're okay with it, I want to put some heat on that area to see if we can loosen up those muscles and maybe get those points down a couple. All right, let me go warm it up for you. I'll be right back. All right. And does it feel okay right here?
Yeah.
Okay. We'll just leave it on there for a couple minutes.
Okay.
And while we're waiting, let's chat a little bit more. Can you tell me a couple of things, anything that you want to get out of occupational therapy, some things you want to work on?
Yeah, so since the accident, I've lost a lot of privacy. I need help with a lot of my self-care and just doing the things that I used to do before. My family is really involved, like really involved, so sometimes it can get a little overwhelming. And my caregiver is great, but there's just some things like that I don't have as much privacy for that I'd like to. So like brushing my teeth and, washing my face and things like that, I'd love to do on my own. And I'm really hoping to be able to get back to work soon, so maybe even like being able to put some makeup on and feeling confident and professional again.
Sure. Those all sound like great goals to me. We can definitely work on them. And along with some other things, that was what I was thinking as well. Something else I want to show you. I don't know if anybody's ever talked to you about pressure sores.
Yeah, I have them pretty reoccurringly since the incident.
Okay. I did read that in your chart. I just wanted to make sure that you were aware of what was going on. And then do you know how to manage those, or I can help you set up kind of a routine to check for them and make sure you're not at risk as much?
I know that they told me that I need to be aware, but it's hard for me because I can't really, do it on my own right now. So my caregiver helps a lot with that.
Okay. Yeah, so I wanted to just tell you about a few things. I know you're in your wheelchair a lot. So every 30 minutes or so, you should be moving.
Okay.
And I know you don't have function below your elbows, but you can get your caregiver to help you shift your weight to one side, move forward a little bit. And then I also have this pad here that you can put on your chair.
Okay.
So you can put this under your rear end, and it kind of gives you a different position.
Okay.
So there are lots of different kinds of these. Some are slanted, so they can just manage your weight a little differently. And then along with pressure sores, there's another thing I wanted to talk to you about called autonomic dysreflexia.
Okay.
Have you ever heard of that?
I've heard of it, and they told me that I need to be aware, but it's just another medical jargon term that kind of just gets mumbled with the rest of them.
Yeah, I understand that. So basically, that comes from different points of discomfort. So obviously, pressure sores aren't the most pleasant thing. So sometimes if those are bothering you, if even something as simple as your clothing being kind of bundled up underneath you and that's giving you a little bit of resistance, sometimes you can feel yourself getting really tense. Your blood pressure is shooting up. You'll start sweating really badly. And that is actually very dangerous for you, especially at your level of injury. So we want to make sure that if you are ever feeling any of those things, you need to tell a caregiver. You can also check yourself for those signs. The places that you can access, like if you can look at different parts of your body, maybe move around your clothing a little bit, that'll really help decrease that. We call it a noxious stimulus,
Okay.
whatever is bothering you. So anything you can do to eliminate that,
Okay.
that'll really help with that.
Okay.
All right. How's that shoulder feeling?
Better. It's definitely not so tight anymore.
Okay, so let's go ahead and remove the heat.
Okay.
I have a couple of other things I want to work with you on.
Okay.
So I'll take this here. All right, so let me introduce you to this handy little splint here. This is a dorsal wrist support.
Okay.
So I know you don't have function in your wrists, so
Yeah.
sometimes they might droop a little bit.
Yeah.
So I know that can be frustrating if you're trying to do some different things. So the neat thing about this is that it has a little pocket here that we
Mhm.
can put different things in, like a toothbrush or
Okay.
a fork. So then you can like feed yourself independently, brush your teeth. So what do you say we try?
Yeah.
Okay. And then which arm would you be more comfortable with brushing your teeth?
My right arm.
Okay, so I'm gonna come around you if that's okay,
Okay.
and help you put it on. So if you could lay your arm flat on the table for me. Okay. I'm just gonna place this back part over your wrist and hand area here. And can you pick up your arm for me? Okay. Gonna do this part first. And then even though I'm just now getting that wrist thing, can you feel how your wrist is kind of held in place there?
Mhm.
Okay. So does that feel you're not really going anywhere there?
Mhm.
Okay. So I'm gonna put the toothbrush in. We're gonna practice a couple of different things with the toothbrush. So I'm gonna place this in for you. You're
Okay.
gonna have to have your caregiver or one of your family members, if they're around,
Okay.
put this in. So I'm gonna take your hand here. This toothbrush is a little thick, but we can make it work. Okay. So I'm just gonna demonstrate. So you have the toothbrush kind of here right now.
Mhm.
So if you can use your elbow and kind of bend it towards you,
Okay.
you can get a lot of movement here and kind of bring it back and forth across your mouth.
Okay.
And you should be able to brush your teeth that way. Do
Okay.
you want to give it a try?
Yeah. So the elbow.
Yep. And then you can move your shoulder out a little bit. Yeah. Do you think you would be able to brush your teeth pretty well
Yeah.
using that? Yeah, so you don't have to depend on anyone for that. I'm
Okay.
hoping that'll give you a little bit of confidence being able to
Mhm.
freshen up in the morning yourself. Okay, so I'll take this out a while. So an important part of brushing is obviously putting the toothpaste on
yeah.
the brush.
That's been hard for me.
And so what I have here, this is a sticky material called Dicem.
Mhm.
So I'm gonna put it on the table here,
Okay.
and I can put your toothbrush on, and it's not
Okay.
really going anywhere. So I put some toothpaste in a soap pump for you.
Oh.
Yeah. So I don't know if you've tried this before.
Okay.
You could even do this with the toothbrush in your splint, but we're gonna leave it on the Dicem for now.
Okay.
So what I want you to do, I'll demonstrate it first, and
Okay.
I actually won't put it on your toothbrush yet. I'll let you do that.
Okay.
So what I want you to do, you can take your forearm and just kind of push down
Okay.
here with your shoulder. And you want to get a lot of movement from your shoulder. And with the weight of your forearm, you should be able to get the toothpaste to come out.
Okay.
You can try it with either arm.
Okay.
Let me know if you have any questions. I'll actually put this on the Dicem so it doesn't slip out from under you.
Okay. Could you move it closer?
Of course.
Thank you. So lift and just.
Yep. There you go. See some of it coming out there?
Yeah.
Yeah. So with the weight of your hand, have you ever used like a French press or anything?
Yeah.
So it's kind of that idea.
Okay.
That's what it makes me think of. If you want like a steady stream of toothpaste to come out, you can just leave your forearm on there, and
Okay.
gravity will really do the work for you. It'll just start coming out.
Okay.
So do you want to try putting it on your
Sure.
toothbrush? Okay. Let's actually keep this on the Dicem. Okay. So it might take a couple of tries to get the toothbrush where you want it, which would also help if we have it in the
Right.
cuff.
Okay.
But if you want to try it a couple of times there you go. So we just need to move this a little closer to the toothbrush here. There you go.
Oh, perfect.
That's awesome. So then you can take the toothbrush, brush your teeth on your own, and I think that'll really help you in the mornings.
Awesome. Thank you so much.
You're welcome. Any questions for me?
Nope, I don't think so.
All right. Great job today, Ingrid.
Thank you.